Asperger Syndrome, now considered part of the autism spectrum disorder, ASD, in modern medical classifications, is a developmental condition that impacts a person's ability to socialize and communicate effectively. It was first identified by Austrian pediatrician Hans Asperger in the 1940s, who observed children with difficulties in social interaction and unusual patterns of behavior. Although Asperger's work was overlooked for many years, the term Asperger syndrome gained widespread use in the 1980s and 1990s, particularly after being included in the Diagnostic and Statistical Manual of Mental Disorders, DSM-4, in 1994. However, with the publication of the DSM-5 in 2013, Asperger syndrome was no longer diagnosed as a standalone condition but was integrated into the broader category of autism spectrum disorder, ASD. This change reflects a growing understanding of autism as a spectrum, with varying degrees of severity and characteristics. Despite this, the term Asperger syndrome is still commonly used in medical and popular discussions, especially in reference to individuals who show specific traits of the condition. Core symptoms. The hallmark symptoms of Asperger syndrome revolve around difficulties in social interaction, restricted or repetitive behaviors, and focused interests or activities. While individuals with Asperger syndrome generally have average or above average intelligence, their challenges lie in navigating social contexts and forming relationships. Social interaction difficulties. Individuals with Asperger syndrome often struggle with interpreting social cues, understanding nonverbal communication, and engaging in reciprocal conversations. They may have difficulty understanding facial expressions, tone of voice, and body language, which are crucial for effective communication. This can lead to misunderstandings and social isolation, as they may come across as blunt, uninterested, or emotionally distant, even if that is not their intention. Repetitive behaviors and interests. A defining feature of Asperger syndrome is the tendency to engage in repetitive behaviors or have highly focused interests. These individuals may become intensely interested in a particular subject or activity, often to the exclusion of others. For example, someone with Asperger syndrome might spend hours reading about a specific topic, collecting items related to that interest, or focusing on a specific routine or ritual. Communication challenges. While people with Asperger syndrome typically do not have language delays, their communication may still appear odd or formal. They might use complex vocabulary or long-winded explanations in conversation, while struggling to understand more casual or idiomatic expressions. These individuals may also find it difficult to initiate or maintain conversations, especially with those they do not know well. Sensory sensitivities. Many individuals with Asperger syndrome experience heightened or diminished sensitivity to sensory stimuli. This can include being overwhelmed by bright lights, loud noises, certain textures, or even specific smells. On the other hand, some individuals may not respond to pain or temperature changes as strongly as others. Diagnosis. Diagnosis of Asperger syndrome typically involves a comprehensive assessment, which may include developmental history, interviews with caregivers or teachers, and standardized tests. Because individuals with Asperger syndrome often have normal or above average intelligence and do not have significant cognitive delays, diagnosing the condition can sometimes be challenging. Additionally, individuals may present symptoms that are similar to other developmental disorders, so a thorough evaluation by a trained professional is essential for an accurate diagnosis. The criteria for diagnosing Asperger syndrome are based on the presence of social communication difficulties and restrictive or repetitive patterns of behavior that are evident early in development. However, these symptoms must not significantly impair the individual's ability to perform daily activities, such as attending school or holding a job, for a diagnosis of Asperger syndrome to be made. Treatment and support. While there is no cure for Asperger syndrome, various therapies and interventions can help individuals manage their symptoms and improve their quality of life. Treatment plans are often tailored to the specific needs of the individual and may include the following. Social skills training. Social skills training helps individuals with Asperger syndrome develop better communication skills, recognize social cues, and interact more effectively with peers. This may involve role-playing, practicing conversations, and learning how to navigate social situations. Cognitive behavioral therapy, CBT. CBT is often used to help individuals with Asperger syndrome address anxiety, depression, or other mental health challenges that may arise from their difficulties in social interactions. CBT can also assist with managing repetitive behaviors and interests. Speech and language therapy. Speech therapy can help individuals with Asperger syndrome improve their communication skills, including understanding nonverbal cues, tone of voice, and conversational turn-taking. Occupational therapy. Occupational therapists can help individuals with sensory sensitivities, motor coordination challenges, or difficulties with daily activities, such as dressing or organizing tasks. Parent and caregiver support. Education and support for families are crucial in helping them understand and address the unique needs of an individual with Asperger syndrome. Parent training can help caregivers better support their child's development and well-being. Prognosis. The prognosis for individuals with Asperger syndrome varies depending on the severity of the symptoms and the level of support available. Many individuals with Asperger syndrome lead fulfilling lives, pursue higher education, and hold successful jobs. However, challenges with social interaction and sensory sensitivities may persist throughout adulthood. Early diagnosis and intervention are key to helping individuals with Asperger syndrome develop coping strategies and achieve their potential. In conclusion, Asperger syndrome is a condition that affects an individual's ability to socialize and communicate, while also being characterized by restricted interests and behaviors. With the right support and interventions, individuals with Asperger syndrome can lead successful and meaningful lives.
Thank you for watching. Please subscribe our channel.